Well, good afternoon and welcome to Waco City Hall for our weekly press conference on this COVID pandemic. I'm Larry Holsey, Director of Municipal Information and Communication for the City of Waco, and I'm the moderator and host for this weekly press conference. We are observing social distancing in this room, third floor conference room. We have only 4 persons, but we're all masked up and taking care of ourselves. Down in our studio on the first floor of City Hall, we do have an American Sign Language interpreter doing a sign language interpretation for those who need that. And we always are also recording an audio track in Spanish that will lay over the video of this and re-air this afternoon and on our website as well, starting at 4:30, and it'll be in Spanish. And always so gracious to take time out to be a part of this to start off with is our City Council member for District 2, Hector Sabito, to speak to our Spanish-speaking people to let them know that we want them to hear what's going on today too. Hector, thank you again, and take it over.
Good afternoon, Larry. Thank you so much for the invitation. Para ayudar a nuestros ciudadanos que hablan español a saber lo que se dice durante esta conferencia de prensa, un traductor está grabando una traducción en español en vivo durante la conferencia de prensa. Esa grabación completa en español reemplazará el sonido del inglés en el video y una versión en español de toda la conferencia de prensa se reproducirá en el canal de cable de la ciudad de Waco aproximadamente a las 4:30 de esta tarde. Puede ver la conferencia de prensa en el canal 10 o por internet en vivo en wccc.tv. Larry, thank you again for the invitation.
Thank you, sir. I appreciate you big time. Again, joining us again this week as our participants, we have our Waco Mayor Kyle Deaver. We have McLennan County Judge Scott Felton. From the Family Health Center, we have Dr. Jackson Griggs back again. Good to have you back, Dr. Griggs. We have Dr. Mark Ellison, who's with Baylor Scott & White Hillcrest, and Dr. Brian Becker, Chief Medical Officer with Ascension Providence. Gentlemen, thank you again for taking your time to be here. We always appreciate that. We're going to follow the same routine we've done before. We're going to let each one of you make an opening comment, whatever's on your mind, heart, the information that you have from your particular entity or whatever's going on with you. And then we'll open it up. I'll read the questions that we have collected over the last week since the last press conference. Then we have 2 representatives from the media that have registered to be a part of our communication today. They'll have 2 questions each. And then we'll close with closing comments from each of you. So let's get started. Let's start off with, we'll go in the order of Dr. Jackson Griggs first, then followed by Brian Becker, Mark Ellison, Judge Felton, and then Mayor Deaver. So if we will, Dr. Jackson, would you open us up, please?
Absolutely. Thank you, Larry, and thank you, Mayor and Judge, for the invitation back. I'm going to start with numbers, as I have consistently done worldwide. We've seen 33.5 million cases, and we crossed a painful milestone earlier this week of 1 million deaths globally due to COVID-19. In the United States, a fifth of those deaths, so 200,000 deaths have occurred in the United States, and we've had about 7 million cases to date in the United States. So currently, COVID-19 is the number 3 cause of death in the United States, following heart disease and cancer. In Texas, we've seen 750,000 cases to date and 15,600 fatalities in our state. McLennan County, this is the update as of this afternoon. Our total number of confirmed cases to date is 8,179. 462 of those are currently active. Again, as of this afternoon, the Health District has received notification of 57 new cases of coronavirus. 49 people are currently hospitalized with COVID-19. 16 of those 49 are receiving ventilator support. There have been no additional deaths in our community to report today, so the total remains at 111 community members who have died from COVID-19. There have been over 68,000 coronavirus tests completed in McLennan County. 89% of those total tests have been performed on McLennan County residents. Within elder care facilities in McLennan County, currently there are 7 ongoing facility outbreaks, again defined as 1 or more residents diagnosed with coronavirus. There are 29 active cases right now in these 7 facilities. 21 of those are staff members, and only 8 of those are residents of those elder care facilities. At the county jail, right now, there's only 1 active case. There have been 2 new church clusters within McLennan County, and the public health district is helping these churches with those 2 outbreaks. 12 independent school districts are reporting cases on campus, and there's been 1 private school since we last reported. Within those 13 schools, there are 38 active cases, 23 students and 15 staff make up those 38 active cases. Still, each of these schools has low numbers, so there have still not been any instances of widespread transmission in schools to date. Now I'm going to switch to share with you some slides that report on cases per 100,000 that I mentioned at a previous press conference. So what you'll see here is a graph showing the United States, new cases per 100,000. Remember, we show new cases per 100,000 so we can compare populations that differ in size. So we're looking at equivalent percentage of new cases based on overall population. So if we'll start with the United States, and you'll see that less than 20 individuals per 100,000 has been pretty consistent since March, when the pandemic really began to gain steam. If you'll look here at the orange line, what you'll see is that Texas, after mid-June, Texas began to have more new cases per day per 100,000 than the United States, and that's been pretty consistent since mid-June. Next slide, you'll see McLennan County. And in McLennan County, we fared far better than both the state and the nation until also mid-June, where we had a big jump in cases. And again, proportionally compared with the state and the country, we've had more cases relatively consistently since mid-June. I'm going to add here the Harvard Global Health Institute strata or levels that show degree of community spread. In the Global Health Institute's Path to Zero paradigm, what you'll see is here is that in this 1 to 10 new cases per day per 100,000 population, they call it community spread. And we really entered that community spread, and we're just in that strata briefly in June when numbers were starting to pick up. And then from 10 to 25 cases per day per 100,000 rolling average, it's the accelerated spread zone. So this is kind of that risky area before we reach the tipping point. And the tipping point is where we see rapid spread of disease in a community, and which is exactly kind of what we saw in July. And we've had these brief peaks in mid-August and late September, where we have seen new cases per day kind of pop up. But we've been able to date to keep it from that exponential spread in August and September. And some of that, I think, is because we've been able recently to get our positivity rate down. Here is the McLennan County positivity rate at 8.1 right now. Remember, lower is better in terms of positivity rate. The state of Texas is at 5.6. McLennan County is a little higher at 8.1. The more tests we perform, the larger the denominator, and it brings that positivity rate down. Global Health Institute indicates that mitigation or slowing the spread of the disease really occurs when your positivity rate is less than 10%. And suppression, where we can actually achieve a close to 0 new cases, would only happen if we were able to get our positivity rate less than 3%. And so you see we've been in this mitigation zone, which is probably why we have not had escalating cases that's crossed that tipping point that I described earlier of 25 new cases on rolling average per 100,000 in population. Now let me show you our effective reproduction rate. This is kind of a report card on our health behaviors. When we are following strict guidelines and social distancing and wearing our masks consistently and not getting indoors with a lot of other folks, we'll see this effective reproduction rate be below 1, which indicates that the epidemic is on the decline. One individual spreads the virus with fewer than one other individual. Right now we're 1.03, so we still have some area for improvement. Texas is at 0.91, which is good news. But like I said, we can still, I think, improve on our health behaviors to get this reproductive rate lower than 1 and decrease the spread. This is data from the Family Health Center, and this is specifically in children aged 4 to 18 years old. This is a timeline that shows a full calendar year, and this blue line indicates the average number of influenza-like illnesses and COVID-like illnesses per day on a 7-day moving average. So in January, you see this big peak, probably flu, January, February, and in December, again, a flu peak here. You see school starts and you get a climb in cases because kids are sharing cold viruses, and we're seeing those in our clinic. So you see school start, we see a jump up in cases of cough, cold, fever. In the summer, you see a big dip in those because kids are outside playing. So again, we're talking about children only here, and these are influenza-like, COVID-like illness. We use that term interchangeably, influenza-like, COVID-like illness, because the symptoms are virtually identical. So this is averaging our number of visits per day in the years 2017 to 2019. Now I'm going to overlay on top of that this year, and you'll see some differences. So what you'll see is earlier this year, before the pandemic arrived, you'll see a very similar kind of spike, indicating this was flu in January, February. And then right after spring break, what happened? Well, we sheltered in place. We all stayed at home, and so we saw this drop in influenza-like and COVID-like illness, and we didn't see much at all in our clinic. And then in June and July, when we saw a community-wide spike in COVID, we also began to see more children who had COVID-like illness in our clinic. And I'm just showing you this to point out the fact that we have been seeing a pretty rapid climb in COVID-like illness among children since school started. Again, the reason this is valuable is because of not because children suffer from major sequelae, major problems associated with COVID-19, but because as we see cases climb in children, we do expect to see a spillover effect and cases in vulnerable adults. So this does create some concern. This may be a lead indicator of cases that are coming, and I just wanted to make you aware of that. These are just markers for why we've seen changes in the line when we had economic reopening in May, which led to a climb in COVID cases. The Texas mask order was put into place, which led to a decrease in cases. And then, of course, when children went back to school and university and all the other activities began in the fall, we saw this climb in cases. So that's all I have for my opening remarks. Thank you.
Thank you, Dr. Griggs. Let's hear from Brian Becker, Chief Medical Officer for Ascension Providence. Dr. Becker.
Thank you again for having me this afternoon. Enjoy participating in the press conference, and it's always enlightening, I think, for our community to have a variety of folks presenting on this panel. As a representative of Ascension Providence, I can speak to the volumes that we have seen over the past week. They've been mostly flat, maybe a bit of an increase toward the latter part of the week in hospitalized COVID patients. We continue to have a census that consists of about 13 to 15% of our hospitalized patients that are being managed for COVID or have a concomitant COVID infection. So that's pretty flat for the last 2 to 3 weeks. That's not been a huge increase for us. It is a bit of frustration. We continue to hope that we will see that number decline, and it just seems to hang on at a steady rate. Having said that, we continue to have adequate capacity to manage our COVID patients along with those who present to our facility with other medical needs. So we are not pressed for capacity across the organization. I think that as we move into flu season, we kick off in this week where we screen everyone. They have received a flu vaccine. So every hospitalized patient across the organization will, moving forward, be asked the question, have they had a vaccine? And if not, can we give them a vaccine before discharge? So we are doing that at the hospital. I would encourage the rest of the community to engage in that endeavor as well. So get out and get vaccinated. Again, thank you for having me here this afternoon.
Thank you, Dr. Becker. Next, let's hear from Dr. Mark Ellison from Baylor Scott & White, Hillcrest.
Good afternoon, and thank you for having me, Mayor, and pleased to participate in this panel and this discussion. We've got a great community, and we've got a great team leading this way. So, as Dr. Becker said, we also at Hillcrest have been somewhat flat, but a little bit of an increase in some of the COVID cases we're having. People continue to get very, very sick and can have lengthy hospital stays, and some are requiring full life support on ventilators with multiple other interventions, which causes me a great deal of consternation because for the most part, this disease is avoidable and treatment options are limited. So as we've been preaching, we want people to be safe, and that includes wearing a mask in public, socially distancing, and please don't let your guard down. We are also seeing flu cases already in the community and in the emergency department. I don't know if the numbers are for this last week, but the week before we had 5 cases already for flu. And if we're already seeing a few flu cases, it's spreading, and it spread similar to COVID. So again, wearing masks, and fortunately there is a vaccine for the flu. So I've got my flu vaccine, and as Dr. Becker said, we are already at Hillcrest. We're screening our patients for the flu vaccine and giving it to those who haven't already gotten it. So please get out and get your flu vaccine.
Thank you,
I have
Dr.
more comments
Ellison.
as we go. Thank you.
Let's hear now from McLennan County Judge Scott Felton. Judge?
Good afternoon, and I've got my flu shot as well, so I'm ready. It's been a real interesting last week. We had a visit that was hosted by Baylor University with Dr. Deborah Burks, the coronavirus response coordinator for the White House. And in our conversation with her and others of the community, both medical education and the both city and county folks involved, that she was very concerned about our numbers not coming down like they hoped we would. And of course, she communicates very closely with our Governor Abbott. And later, I received a call from Chief Nim Kidd with Texas Department of Emergency Management, who is representing Governor Abbott. And he called to talk to us about partnering with Texas Department of Emergency Management, as well as some of their folks that help run large testing operations to partner with them on what we call a surge testing project. And so that was at the end of last week, and our emergency management people here locally and city and county folks are working on that now, and it'll be more discussed about that here in a little bit. The mayor will have more detail on it. But it could be very important in helping us get our numbers down. One of the other things we learned is that one of the main factors at looking at how the citizens of our community do business in regards to working within this pandemic is a percentage of occupancy that we have relative to what our numbers look like. And one of the key factors in there is that if the governor would like to see that no more than 15% on a rolling day, 7-day average of the patients in these hospitals be COVID related. And so unfortunately, I got a letter from Dr. John Hellerstedt. He's the commissioner of the Department of State Health Services. I got that on Sunday afternoon, that in their calculation, we exceeded that 15%, which was a surprise to me and others because our numbers do not show that. But I know there's questions about that, and so I'll wait to talk more about that. So it's important that this group works together and helps communicate to the citizens in this area, and everyone needs to stay tuned, especially on this particular subject of the governor asking us to roll back to the prior order, which we'd come back from 75% occupancy in restaurants and places of business to 50%, which could be a negative economic impact back to our community. And we understand also that those measures are only taken to, keep our citizens safe, and that's important to us. I can tell you very much so, and is a priority. But they have to work hand in hand. So those numbers we'll talk about in this rest of this presentation. But our numbers different from how the state calculated theirs, and so I'll look forward to answering those questions and others that may come in. Thank you.
Thank you, Judge. Waco Mayor Kyle Deaver. Mayor Deaver.
Good afternoon. Thank you for joining us again today. There's a lot to talk about today. Before I discuss our response efforts regarding the pandemic, we need to talk for a minute about a couple of other important matters. First, this is the last week to complete the census. The federal government recently set the deadline for responding to the census as October 5th. That's next Monday. If you haven't responded, please do it today. Please ask your friends, coworkers, and family members who have not responded to respond today. It literally takes no more than 10 minutes, and the results will last for the next 10 years. I'm going to put up a website because it's so important that you get this. You can simply fill out the form that you received at your home and mail it in, or better yet, just go online to my2020census.gov. If you have internet access through a computer, tablet, or smartphone, this is the easiest way to respond and be sure you are counted. I can't overstate how important this is. It will determine federal and state funding as well as representation at the local, state, and federal levels for the next 10 years. Every person who is not counted in our community will cost our community $15,000 in state and federal funding over the next 10 years. Think about that. A family of 4 who is not counted will cost our community $60,000 over the next 10 years. That's a lot of money that can go to improving streets, parks, and many other important projects and services that are important to you and important to all of us. So please fill out the census today. Next, our region's supply of blood is dangerously low. We received word of this from Carter Blood Care last Friday. The available blood supply of most blood types is less than what is typically needed for 2 days. For the blood types O positive and O negative, commonly used in emergencies, there is less than the supply required for 1 day. Please give serious consideration to making an appointment today to give blood by going to carterbloodcare.org and clicking on donate blood. Now let's move to our community's pandemic response. I want to get a few slides up here as well. This is always a challenge when we try to share our slides. All right. This is the first slide shows that our testing has now, our cases have now exceeded 8,000 in our community, as Dr. Griggs mentioned earlier. Our new confirmed cases each month have been bouncing around between 40 and 50 for the last 3 weeks. Baylor's cases continue to come down. Their average on a 7-day average of new cases is less than 10 now. They're doing a great job of containing coronavirus on the campus of Baylor. Our hospitalizations have been bumping between 40 and 50 cases for the last couple of weeks. However, you can see that our patients on ventilators have risen considerably over the last couple of weeks, and that is obviously a concern because these are our sickest patients. And often when a patient goes on a ventilator, that leads to, that's the last step before the patient's death. It's not that the ventilator leads to death. It's simply that they are not able to bring the patient back from that. And our cases, our deaths this past week exceeded 10, or were 10. That is the worst week we've had in several weeks on fatalities. We have now crossed another grim milestone, which is over 100 deaths from COVID-19 here in our community. And I just need you to think about and pray for the families of those victims who are having to deal with this. And as Dr. Eliason said, that the saddest part of that is that so many of those deaths are unnecessary deaths because people weren't taking measures to prevent the spread of COVID-19. So we've got to continue to do our part on that. I want to talk about, we've got free testing this Friday, October 2nd from 8 to 5 at Waco Fire Station number 5. That's at 4515 Bagby, just off New Road. This is drive-through testing. It's the mouth swab. No symptoms are required. You must, however, register ahead of time. So go to covidwaco.com and click here for free COVID-19 testing to get more information and to register. And then there's this surge testing that we are so excited about. To bring this to Waco and McLennan County, and to those from adjacent counties who want to come into Waco to be tested. This is largely a result of Dr. Burks visiting Waco, and really appreciate Baylor University hosting Dr. Burks. Appreciate Dr. McCown, the MCC president, for helping to connect Baylor with Dr. Burks in advance of that visit. And then we are so grateful for the assistance from the state, from Governor Abbott, from the Department of State Health Services to stand this testing up. The initial testing sites will be at Waco ISD Stadium, the Convention Center, and MCC. Other sites will be planned around our community. This is a tremendous opportunity for us to identify asymptomatic carriers of the coronavirus in our community. I can't stress how important it is for everyone who can to get tested during this opportunity. We have between 30 and 40,000 tests that will be administered. And it is a nasal swab, but it is not the deep nasal swab, and it is self-administered. So you control the way that it is done. There will be a nurse proctoring the test to be sure that you do it properly, but you actually swab yourself. Again, you will need to register for this testing. As always, go to covidwaco.com and click here for free COVID-19 testing to get more information. That's all I have for now, Larry, and I'll look forward to the questions.
Okay, very good. Well, let's get into the questions because we have a number of them. And right off the bat, we'll talk about one that you kind of talked about, Judge. The county has disputed the state health commissioner's claim that COVID-19 patients account for more than 15% of hospitalizations in the 5-county region. What do you believe the correct number is?
Well, first of all, the state their number may be different from ours because maybe all the entities that provide the information to the state may not be providing it in the proper format. And that could be one of the problems. So I don't blame the state. I'm just pointing out that we calculate a different number. The 5-county region is called the TSA. This is a trauma service area, and ours designation is M. And it's McLennan, Bosque, Hill, Limestone, and Falls. And a calculation that we did today, that we are showing that we are in the 11% range overall. And so, admittedly, we found some mistakes in some of the numbers that we were providing as well. So, we're going through the exercise. We've asked the governor to give us some time before this order's put in place. Actually, the order's in place now, and ask them to get us an answer back whether they agree or disagree fairly quickly. So hopefully we can get that out. But we think it, as of today, and we calculated every afternoon, that today is around 11%.
Okay, all right. How many more COVID-19 patients could Waco's 2 main hospitals take if there is a spike this fall, and how would a bad flu season complicate that picture?
Dr. Eliason, can you speak to that, please?
Yeah, gladly. I can speak for Hillcrest. So we have a lot more capacity, which again breaks my heart to think of having more patients than we already do, but it's possible. And we are prepared to take more patients if we come to that. So within our hospital, we have the capacity to take and manage 39 patients on a ventilator, and many, many, many more than that short of a ventilator. So yeah, we can certainly take more. Presently, we have 6 patients on the ventilator, or 7 patients on the ventilator. So we can go from 7 to 39, which is a dramatic increase, keeping in mind that most patients, we're talking maybe 5% of patients who develop COVID would have to progress to a ventilator. So how would the flu season affect that? Well, flu patients do get sick. They do not get as severely ill as patients with COVID. Generally speaking, a few do go on to progress severe respiratory failure, but it could certainly eat up resources and take away from our capacity to care for COVID patients. So again, that's why we're strongly encouraging people to get flu shots and to take care of themselves and to socially distance, just as they are trying to avoid COVID, but to avoid the flu.
Dr. Beck, can you speak to it from Providence Point?
Yes, sir. So I think we all had the opportunity to flex our muscles a bit, both in real time with 2 prior surges that we've seen, as well as the ability to put pen to paper and figure out what are our capabilities. So if we look at our surge capabilities, for months now, we've had in place a tiered surge approach, and have the capability to surge to about 40% more from a capacity standpoint, double our ICU capacity, almost triple our ventilator capacity. So I think that much like what Dr. Eliason alluded to, I think we have more than adequate space to accommodate a significant increase in COVID patients. And fortunately at this point, we've not been stretched to that limit. Even with the worst of cases that we've seen. I think the flu season is always a time of year where hospitals are looking at, are we adequately staffed? We typically will see a surge in patients, and both facilities are running at near capacity in a normal flu season with just increased hospitalizations. So you layer on top of that the potential for COVID patients, and that gets pretty complicated pretty quick. But I do have a great deal of confidence that both systems can manage a significant increase in volume.
Okay, thank you. Has there been any follow-up review of Baylor game in which some students were seen to be in close quarters without masks? And any contact tracing or testing results from that game?
Well, it's too early to know for sure what the effects of students and other fans not following Baylor's guidelines for the football game will be. Judge Felton and Dr. Griggs and I had an opportunity to talk to Dr. Livingstone and others from Baylor this morning as part of a regularly scheduled call that we have with them and other education leaders to talk about what they have done and what they plan to do Baylor's taken a number of steps to try to mitigate the issues that come with football games. First, they tested approximately 250 of the 2,500 students who attended the game at random before the game. They had 2 positive results from those 250 tests, and those students were obviously then isolated and not able to attend the game. They also had a small number of students. They were trying to test 300, and they had some number of students who failed to show up for the testing, and their tickets were then deactivated and they weren't allowed to go to the game. Following the game, they also will be testing 600 students randomly out of the 2,500 or so students who attended the game. And obviously they are actually doing their own contact tracing at Baylor, and they will be contact tracing any positives that come out of that. One really interesting thing is that the 500 freshmen who attended as part of the Baylor line all wore Bluetooth bracelets that could sense proximity to other students and determine if they were closer than 6 feet or nearer than 6 feet from other students for an extended period of time. And all of that will be very helpful when it comes to contact tracing if any of them test positive. So I think you can see, I think Baylor and everyone else understands that football games are sort of inherently risky, but they are doing a lot of things to try to combat the problems that could come from that.
Okay. Considering there's no end in sight, will the city and county seek more funding for rental assistance and small business recovery fund?
Larry, the city is currently evaluating both the rental assistance and small business recovery fund program to determine if additional funding is needed to support either or both of the programs. Staff is also reevaluating the reopening of the small business program to determine the need and impact on the grant funding for new and previously assisted businesses. The rental assistance program has a fund balance of $343,000. For those who are interested in applying for the rental program, it is very important that participants provide all required documents when submitting an application. This allows staff to process the assistance on behalf of the participant much faster in order to avoid evictions and disconnection of utility services. To ensure that you have all required documents prior to applying for assistance, please visit covidwaco.com. I talk about that a lot. covidwaco.com has so many resources, and you can find the resources there to view the rental and mortgage assistance page under the resources tab, or get there directly by visiting covidwaco.com/rental mortgage-assistance. On that page, you can review helpful links to documents that will help you fill out the required documentation.
Okay. This next question is one we could have had 6 or 7 weeks ago, and we still keep getting asked the same question over and over again. Why should I get tested?
Dr. Griggs, can you speak to that, please?
I'd be happy to. And I'm going to answer this in light of the fact that we have free public testing that's currently available and will be available in the next several weeks. So imagine for a moment a virus whose sole aim is to infect as many people as possible. That virus wouldn't sound the alarm every time it entered into a new person. It'd be sneaky, trying to replicate in the host and spread to as many other people before it tripped an alarm. It would do it in secret. In this case, our immune system is the alarm. The alarm is the symptoms that we feel when we're sick. It's fever and cough and headache and body aches and shortness of breath. A key reason this virus has spread globally at pandemic levels is its ability to multiply and spread silently before we have any symptoms. On a statewide Zoom call with Dr. Fauci this last week, I heard him cite a study that demonstrated that over half of coronavirus transmission occurs when people are completely symptom-free. Again, this means people who feel great are walking around unintentionally spewing virus into the air around them without knowing it. In our county, I feel like we've done a fairly good job testing people who have symptoms of COVID-19. What we haven't had yet is a major and ongoing opportunity to test people who have minimal or passing symptoms, like just a mild headache and fatigue or a few chills, or people who lack symptoms at all. And with this new availability of public testing, we have an opportunity for our community to get tested regardless of symptoms. And this is a way to beat a virus who is sneaky. It is to get tested even when we don't have symptoms, to discover whether we have the virus or not. And again, why is this important? It's important because we care for our family. It's important because we care for our neighbors. It's important because we care for those individuals who are aging adults who have diabetes or cirrhosis or kidney disease, or who are obese, who are at risk for dying from this virus. We care about those who live in long-term care facilities, our nursing homes. So why get tested? It's because we care for those individuals. And so during the next 3 weeks, I'd encourage anyone who is out about in the community to get tested. If you've gone to HEB or Target or Walmart in the last week or two, get tested. If you work in an environment where you interact with other people indoors, get tested. If you've eaten in a restaurant, get tested. If you've been in a car with a non-household member, get tested. If you've gone inside the convenience store to pay for your gas, get tested. If you've been in a movie theater, and for goodness sakes, if you've been in a bar, please get tested. If you've had neighbors or friends or extended family in your house, or if you've dropped by someone else's apartment to just say hello, get tested. At this moment, and this is for some reason one of the reasons why I showed those graphics earlier, we're in this very volatile moment of accelerated spread in our community. Virtually everyone is a good candidate for the public testing that is now available. We all want to know if the virus is spreading. And the more we discover, the more we can help limit the spread to those we care about and to those who are vulnerable. And if we all get tested, our numbers will drop. We will indeed save lives, and we'll expedite safer environments for businesses and for the activities that we enjoy in the fall.
Okay, I have one more question about the Baylor game. There's reports that people were not social distancing or wearing masks at the Baylor game. Is this a problem?
Dr. Eliason, can you just talk a little bit about how that works?
Yeah, sure. I can't say whether there were or were not people. I did watch the game, but you know what the cameras showed people wearing masks. And but of course, anytime you're in close proximity to somebody, and especially if you're not wearing a mask, you are at risk. A close contact would be 15 minutes within 6 feet of somebody who has the virus. And as Dr. Griggs said, so oftentimes people won't have symptoms for days after they've contracted the illness. And so you may go to an activity, having been exposed already, be symptom-free, feel fine, but yet be contagious and share with other people. And so any activity where you are not masked and in close proximity to people is a risky behavior.
Okay, I'll let this be our last question before we go to the medium. Why should we quarantine if we don't feel sick? This seems unnecessary.
Sorry, we jumped one there. I wasn't ready for that.
I'll take that one, Mayor, if that's okay.
Sure,
So I think Dr. Griggs just told a scary story of a sneaky virus, and that's exactly what this one is, and spoke very clearly to why we should quarantine. So I think there are two instances where we really ask people to quarantine. So someone who has a known exposure, who was tested and is waiting on that test result, they're at high risk for potentially having coronavirus infection. And so we're asking them to isolate and quarantine until we have that result back and provide a definitive answer on what they should do. The second is someone who did test positive, and now we certainly know they have COVID, and we want to prevent the spread of that virus. I think that for those who don't feel sick, it is a seemingly big ask to stay away from everyone for 14 days, to miss work, to separate themselves from their family. Those are huge ask of anyone. I think the most important thing also Dr. Griggs mentioned, and that is we have a sense of community. We want to protect those in our community. And short of a sense of community, you certainly want to protect those in your family. So those are two key reasons to quarantine, to make sure that you do not infect someone that you love. And beyond that, we don't want to infect another member in our community who will then in turn infect someone they love. So quarantine is a key piece of this. The mask piece is essential, social distancing. Those are all preventive tools that we can use in instances where I don't know that I might be carrying a virus. But once I know that, it is incumbent upon me to make sure I'm separating myself from others so as to not infect others.
Okay, let's go to the Zoom registered media that we have. We have Rhiannon Sagert with the Waco Tribune-Herald on the line, and we also have Drake Lawson with KWGX News 10. Let's go first to Rhiannon. Rhiannon, are you on the line?
Yes, can you hear me?
Yes, sure do. Go ahead and ask your question.
All right, so Dr. Griggs mentioned a possible spillover effect from kids being back in school and becoming infected and then going home. Could you see that becoming as bad as it was in June and July, where we had a lot of family clusters? Would there be a high number of family clusters at that point again?
Dr. Griggs, would you like to address that, please?
Rhiannon, is there a possibility? Absolutely. I think this testing that we have available to us could be a game changer for our community. Of course, just offering it isn't enough. We really need to see the community respond and show up and get tested. We need there to be a buzz about this. We need people to talk it up and share, to ask each other, to ask their friends, hey, have you gotten tested yet? We need to see the whole community respond in a big way in order to prevent the kind of spike that we're trying to avoid. I think we have enough sort of telltale indicators that there may be another surge coming, that the timing of this public free option is just really a gift to our community that we just cannot afford to not take advantage of.
Okay. Let's go to Drake Lawson with KWGX News 10. Drake, are you on the line?
Yes, Larry, can you hear me okay?
Sure do. Go ahead and ask your first question.
Perfect. Judge Felton, I know that I was talking with you yesterday about this letter that you received from the state regarding 15%. You spoke on it quite a bit. Just wanted to see flat out for our business owners here who are maybe a little confused about this, do they have to go back down to 50% right now?
The governor makes all the orders. Our job is to try to educate our community on how and why we do things, but based off the governor's orders. His order came out, I believe it was the 27th, and so that order is in effect. And I think it said the 27th was the day it went into effect, and so the order's in place. In other words, he's asking that we go back from 75% to 50% based on the fact that his calculations or their calculations show that we exceeded on a 7-day rolling average 15% of our hospitalized patients are COVID patients. And we think that maybe some of the numbers they were receiving from the various entities may not be correct, because our number shows to be less than that. In fact, I think I said a while ago that today's numbers look like they're about 11%. So we have not done anything in regards to enforcement or those things because we were in hopes that the Department of State Health Services would give us a letter that they agree or that postpone until further calculations, but we haven't received anything yet. So I guess, and Mayor, unless you have some other thought on that, that's kind of where we are.
No, I really don't, Judge. I agree. I mean, we have not been enforcing this at the city, and it's unlike other things that are pretty clear. A person is either wearing a mask or not. This calculation is fairly complicated, and I have received a couple of emails during this press conference. It looks like they're getting close to getting this resolved, so hopefully we'll have an answer.
Good.
But we're not there. We're not quite there yet.
Okay. Thank you.
Okay, let's go back to Rihanna Sagert with the Waco Tribune Herald. Rihanna, you have another question?
Yes. What does accelerated spread look like, or what would it look like in a school compared to a large community?
Dr. Griggs, could you speak to that, please?
Yeah, accelerated spread is a term that that the Harvard Global Health Institute has chosen to indicate that space kind of between community spread, which is an acknowledgement that this is not just an episodic, sporadic case of somebody who's traveling who happens to show up in your community and get tested and be positive. Community spread being there is active spread from community member to community member. And the tipping point is where you see that exponential multiplication of cases, and that space between just extant community spread and that exponential growth is accelerated spread, where you're kind of beginning to ramp up towards that that inflection point of exponential spread, but you're not there yet. And it's that sort of opportunity to, if your plane's in a nosedive, to pull back on the throttle and or on the control and get the plane level. It's a moment where we can sort of avoid disaster. And in schools, what would that look like in schools? It would be more than the few kind of scattered cases that we have seen in schools. We have not seen rapid spread in schools. We have just seen little pockets of a few cases here and there spread out among multiple ISDs and multiple schools, but we've not seen one school where we've had an outbreak where we just can't seem to ferret out how the spread is happening among students and contain it. So I think that accelerated spread in schools would look like a moment where we'd have to shut down the school and keep all the children from coming to school until a period of 2 weeks passed, and then returning to school when we sort of felt like we had the all clear. Haven't seen that yet, thank goodness, and we may not.
Okay, let's go back to Drake Lawson. Drake, do you have another one?
Yeah, I had a follow-up question just kind of to that order as well. I know that, as Judge Felton and Mayor Deaver said, trying to figure it out. But as of right now, that order is into place. And when reading through it, it does talk about hospitals needing to cut back elective surgeries. I know that we have both hospitals here. So Dr. Elyson and Dr. Becker, just wanted to ask you guys about your stance on that order, and as far as cutting elective surgeries back, are y'all waiting to hear from the state as well, or is it something you guys have already put into place as far as elective surgeries go?
Dr. Becker, could you start on that, please?
Yes, sir. So we also received that same letter as a healthcare system on Sunday, and it spoke to cutting back on elective procedures based on the greater than 15% hospitalized patients being COVID positive. There's been a piece of language that's been in each of the executive orders for several months now, which speaks to a secondary piece. That is a frank statement at the beginning for sure. Secondarily, it also speaks to elective cases can be performed if it doesn't deplete our capability to manage COVID patients. And I think that's a unique piece when we look at a hospitalized patient. Neither hospital is at capacity. Both are taking care of COVID patients for sure. But the smaller the number of normal hospitalized patients, the greater the percentage is of COVID patients. So we are nowhere near depleting our capability to manage COVID patients, which means in alignment with the order, we can continue with elective procedures in the organization. So that is the position that we have taken. And we are working with our city and county officials to make sure that we are correcting the data. I agree with Judge Felton. What appears to be an incorrect reporting has led to an erroneous 15% mark for 7 days, when in actuality on recalculation was between 8 and 11% for each of those days. So we're hopeful to see a letter that rescinds that.
Okay.
Dr. Lyson, any further comment on your side?
Yeah, I would say just because we have cut back on some elective surgeries from the beginning to date, we're still not up to full speed. We are removing healthy patients out of that calculation. And so we are kind of ruining that number, so to speak. But again, I'm not seeing a 15% number on a daily average in our facility. It's still less than 15%, but nonetheless, we still have capacity for COVID patients. We have capacity for regular patients. We have spaces in the hospital that are reserved and set aside for COVID care. So we feel confident that we can take care of both sets of patients, healthy elective surgery patients, non-COVID ill patients, and as well as COVID patients.
Okay.
Thank you. Judge, any further comment on that issue?
Nope, we're good.
Okay, good.
Okay, we're going to quit that, but I do have one more question, Mayor, if it's all right. I'd like, kind of on that same topic. We've actually had that in the list of questions. If the Department of State Health Services calculation of the hospitalization rate is correct, when is the rate calculated, and how long will we have to reduce our business occupancy to 50% and stop elective procedures once it drops below the 15%? So what is kind of the timing? The measurable obviously is a 7-day rolling average. Approximately, does anybody have any idea how long we'd have to be sit on that 50% before we can earn the right to be back?
Judge Felton, would you like to speak to
that? I don't know that I can speak to it with knowledge. I can assume some things, but I would assume that it would be after we achieve 7 days of under that, but I don't know that. I haven't received any directive regarding that. So, this is a kind of a new area for us, looking at restrictions based on the 15%. One thing I don't understand is why they don't use 15% of available hospital rooms, because the hospitals are capable of handling if all those rooms are full. So they've got the capacity to handle it. So why not figure all the rooms rather than just the patients? But I'm sure somebody smarter than me figured that out.
Well, I think that's a good point, Judge, and I don't understand it either, because then when you cut back on doing elective surgeries, it cuts down on the denominator and makes the percentage higher. So it's a strange calculation that doesn't seem to make sense to me either. But as you said, for somebody smarter than you and I probably figured out that it makes sense for some reason.
Yeah, I'd like to talk to them when they figure out who it is.
I have one more point I want to ask about regarding the hospital deal. Is it really fair for McLennan County to be lumped together with other counties like Bosque, Falls, Hill, and Limestone, which are part of that trauma M group, in determining the 15% hospitalization rate, because we have the hospitals here in Waco and McLennan County? And what would McLennan County's percentage be without the other counties involved? What is their contribution, in other words?
Well, if I could speak to that, Mayor, the trauma service area M is smaller counties around the larger county, which is McLennan County. The smaller counties do not have usually the medical infrastructure needed for very serious ill people. Therefore, they come into the larger county, which we're a regional medical area here, and so it makes sense that they would come here. Those numbers from those counties are fairly small, and so I don't think it would have a huge effect if they were not in those numbers. They have to be in some numbers for the governor's purpose. And so it makes sense to me that they'd put these TSAs together. And a lot of them are like this. So I don't think it would make that much difference.
All right.
Yeah, I agree, Judge. I mean, these are set up this way all over the state for a reason. And that's because our hospitals here in Waco are in the best shape to handle trauma. And so this has been in place for almost 25 years now. And it's simply the way that the state organizes its health and medical coverage. And I agree with you that I don't believe that the outlying counties are going to make that much difference to our numbers. It might be that they're actually helping our numbers rather than giving us a higher percentage.
All right. Well, thanks for allowing me to follow up with those. Let's get into our wrap-up discussion now, our comments. We're going to go in the order of Dr. Brian Becker for Ascension Providence, Dr. Mark Eliason from Baylor Scott & White, then Dr. Griggs, and then Judge Felton, and wrapping up with Waco Mayor Kyle Deaver. How about let's start with Brian Becker, Ascension Providence.
Thank you, Larry. Once again, I'd like to thank our city and county officials, Mayor Deaver, Judge Felton, the healthcare organizations that are represented on this call. It has been a pleasure working with all of you guys week to week on this issue. I'd also like to thank, which Dr. Eliason does regularly, the frontline healthcare providers, our EMS folks, our nurses, our physicians, those who provide services that many people don't appreciate across the hospital. They are key in all of this, and it's important that we continue to express thanks to that group of people. Early in the course of the pandemic, there was a great deal of emphasis on healthcare heroes and an outpouring of gratitude, and that has waned somewhat over time. So people are growing weary of COVID, and I think it's important to continue to thank those people. If you know a nurse, if you know someone who works in a healthcare setting, just say thanks. Those people are getting tired and growing weary, and it helps to cheer them up to hear someone say thank you. So I encourage people to do that. I think that's really important. Mayor Deaver spoke to the blood shortage earlier. It's critical that we begin to look at trying to address that. If I'm not mistaken, Carter provides blood products to both facilities. And Carter is a key part of our community. So I would encourage people to reach out, make an appointment, go by, make a donation. It is important that we have those products on the shelf to manage folks when they come in from a trauma or those who are in need of a blood product that's in the hospital. So I would encourage people to donate. And then lastly, again, flu shot, flu season. Everyone on this panel has had their flu shot. And I think it's vitally important to our community this year that as many people as possible get the flu vaccine. So again, thank you for allowing me to participate.
Great, thank you. Dr. Mark Eliason from Baylor Scott & White.
Yeah, let me just say a few things. There are still people in the community who have serious doubts that COVID is real. I still do hear reports from families and family members that there's a conspiracy that COVID doesn't exist, or that we are labeling people with COVID and that have died from COVID because somehow we get more money or somehow makes us look better. And that's just not the case. COVID is real. COVID is a serious disease and an illness that is taking people's lives. And for those that it doesn't kill, it does certainly harm and make people very, very sick. Now, not everyone gets sick, and that's probably where some of the paranoia and suspicion comes from, is because up to a quarter of patients can have no symptoms whatsoever and can have an asymptomatic illness. Or people may get the illness but have a mild case. But it is certainly affecting some people and making them very sick. And so again, as we have preached, we highly encourage people to be vigilant, to socially distance, be responsible, wear a mask, and avoid activities where they come into close contact with other people. And as others have said on this program, it's important that we do these things. We also want to have a very mild flu season this year, and so masking will help, social distancing will help, but we also have a vaccine. So I encourage anyone who has not yet gotten their vaccine to do so. And blood products are also an important point, as mentioned. We definitely need these for regular patients, but also if you've had COVID and have recovered, strongly encourage you to go donate plasma. Carter Blood Bank is receiving donations, and so that is a therapy that we have available, and it seems to be helping more than any other therapy or intervention we have available for helping people recover from COVID. So your donation can mean saving someone's life. And thank you to all who are caring for these patients, and also to you, Mayor and Judge, and Esmeralda and Larry. Thank you for hosting this program and helping us participate and get the word out.
Thank you. Dr. Jackson Griggs from the Family Health Center. Dr. Griggs?
Yes, thank you. I really want to just spend my time in revisiting comments that I've made in previous press conferences, that there already is a twindemic. There already is two pandemics that are happening side by side. One is a secret one, a silent one that we forget to wave a flag about and forget to talk about on a regular basis, and that is the pandemic of mental illness, particularly across the United States. We're seeing so much new instances of mental health problems, and we're seeing folks who have experienced mental health problems in the past who are experiencing exacerbations or who are worsening during this season. It's not at all unexpected. There's a great deal of stress and isolation that this pandemic has caused, and keep in mind that half of all Americans at some point in their lifetime will have a diagnosable mental health condition. We're not talking about the other. We're not talking about something that's rare. We're talking about all of us who struggle with emotional, psychological pain and struggle at some point in our lifetime. So I would just want to say now is a time that we cannot fall into that small-minded thinking of stigmatizing mental illness. We can't be someone who tries to ignore or diminish, and certainly not marginalize mental health problems or people who struggle with depression, anxiety, or any of the variety of other mental health problems. Now is the time to be exceedingly supportive and gracious to our friends, our family who struggle with mental health issues, to, if they're not already in care, to encourage them to seek care. I think we have not only the isolation and pain that comes from the pandemic, but we're in a time right now across the country where we're feeling a sort of toxic political environment. The people that we are close to in our neighborhoods and in our family have strongly different views, and there's bickering and pain that's coming for that reason as well right now. And I think that we just as a community have to rise above that. We have to be the kind of people who love each other above all things, above political differences, and in particularly in a moment where there's a pandemic that is affecting all of us. So please be mindful of the mental health problems that are all around us. Be encouraging and supportive, and try to get others to seek care if you're aware that they're struggling. And this is how we get through this as a community. Thank you. Those are all my comments.
Thank you. McLean County Judge Scott Felton. Judge Felton.
Okay, thanks everyone for participating. I'd like to just make a couple of comments. One thing Dr. Becker said is please extend our gratitude as we see folks that are in the front lines of the medical community. And I'd like to ask Dr. Becker and Dr. Eliason to both extend our gratitude to those folks when you see them. That we're very proud of our medical facilities and the folks that work there. Some of the finest people in McLennan County work at both of those facilities as well as family health. So we don't forget that, and we should never forget it. One thing you might wonder why census is brought up during a talk about the pandemic, but really this is these kind of things come up in a community that are very expensive to deal with. And a lot of times and many times the funding from federal government comes based on population from the prior census. So the mayor gave some good mathematical computations on what it means to us for people who do not fill out the census form. So we really urge you to do that and do it soon. The other thing that Dr. Griggs mentioned was mental health situation, and mental health is a problem that's been here for forever. But the dynamics in dealing with this are just so vast and broad, and I think that the federal, states, and local governments are now understanding a lot more about mental health issue that and trying to put the stigmas aside, as Dr. Jackson Griggs had mentioned. And being that the county manages the jail, we get a first line look at mental illness. We've got over 1,200 inmates in our jail, and I would venture to say that over 30% of them are, and probably well over that, are suffering from some sort and some various severity of mental health illness. And putting them in jail and letting them back out does not cure anything. And so you're going to see that the cities in this county and the county are going to be, this is a frontline issue for us. And so we are going to need allocations from federal and state government to be able to address these and have good outcomes for those people that are affected by that. And then lastly, shop local and pray often. I think that's no matter what our situation, there's always going to be some form of problems that we have out there. Some are more severe than others, but it could be worse. We could not be in the United States trying to deal with this. And this is a great country, and probably the best county in the United States is McLennan County. So I'm glad to be here. Thank you.
All right. And finally, Waco Mayor Kyle Deaver. Mayor Deaver.
Thank you, Larry. I want to thank all of our participants today, Dr. Griggs, Dr. Becker, Dr. Eliason. You all are great examples of the great medical providers that we have here in Waco, and really appreciate your leadership in the medical community and your being here today to share these important messages, and none more important than the message that Dr. Griggs just spoke about mental health. And we have got to break down these stigmas and help people get the care that they need there. It's so important. I want to thank Larry Holsey. Thank you for you and your team for putting this together, along with Julie Olvera there with the city secretary's office, and Kelly Crane with the health district. These press conferences don't happen without a lot of work behind the scenes by these folks and others at the city and county and at the health district and others who help us bring this information to you. And we're really grateful for that work. Again, and also want to thank the press. I want to thank the members of the press that show up at these press conferences, that ask good questions. You all are responsible for helping to get this word out to our citizens. And it's just so important that they get the facts at this point, and that we help them understand things as we see them. And as we have said all along, things are going to change. This is a fluid situation, and sometimes the information may be somewhat inaccurate. If it is, we're going to do whatever we can to correct it and get you accurate information as quickly as possible. I want to again ask you to please make plans to get tested over the course of the next few weeks. This Friday at the at fire station number 5 or beginning next week with the surge testing. This is a tremendous opportunity. We could have a dramatic effect on getting us back to where we were with the COVID response with coronavirus in our community back in April and May, when we had very low numbers of new cases, very low hospitalizations, and only a few deaths. We really need to get back to that. We can get back to that, but the only way we can take advantage of that is if all of us get tested as quickly as possible once this surge testing is stood up. It is going to be capable of handling a lot of people every day, and really important for you to take advantage of that. I ask that you continue to keep the victims of COVID-19 as well as our frontline healthcare workers and our first responders in your thoughts and prayers. As we've said, there's a lot of suffering going on with families who have lost loved ones, but also, as pointed out today, our frontline healthcare workers and our first responders who are dealing with this on a regular basis are really getting tired of it. If you think you're tired of it, and I know I'm tired of it, think about where they must be. This is wearing on people, and they need your thoughts and prayers and support. I saw a parade last week, I think it was last Thursday or Friday, of L3 employees driving through parking lots of the hospitals and probably the Family Healthcare Center too, to say thank you to the healthcare workers. I know that kind of thing is really appreciated. I appreciate them taking the time out of their workday to do that. Please continue to do the things that stop the spread of this coronavirus. As I said, I know we're all tired of it, but we are in this for a long time to come. Stay home when you can, wear your mask. If you go out, wear your mask and keep your physical distance from others, and then wash your hands frequently. I know we say that a lot. It seems to not be able to be said often enough, but please take care of yourself and take care of each other. We are continuing to get through this together. Thank you.
Well, thank you, Mayor. And as the judge alluded, we have the best county, and it's because you all 5 of you all regularly provide us this information that we're just really need to get out and everything else. And Mayor, you mentioned Julie Oliveira and Kelly Crane. I also want to mention Mark Randolph's in the room with us, all wearing our mask. And all 4 of us have had our flu shots too, so we're 100% on all that. So there you go. And I want to remind our viewers the fact that this afternoon at 4:30, we will have a complete replay in Spanish of this press conference. And we will also re-air the whole press conference again at 7 o'clock this evening on our channel. And you can watch it anytime, live or replay anyway, on our website. Just go to waco-texas.com or covidwaco.com, and you just click on the latest news and information, and there it's listed right there. So we hope you'll share that with everybody, because this is great information that everybody in the county needs to hear. And I know a lot of people are working and they're not able to hear this. So we do that as far as that's concerned. Get your flu shots. That concludes our weekly press conference, and we'll be back next week, and we hope you have a good day.